Hello, everyone, and thank you so much for joining us for this webinar. We're so excited to have Dr. Sunny with us and some other guests who are going to help us with the demonstration later. This is something we've been looking forward to for quite some time. So thank you for taking the time to join us today. We're definitely looking forward to talking about the massage therapy program, the massage therapy industry in the field, and also doing the demonstration. So just a few quick things before we get started that I want to remind everyone of. If you have any questions, if you go to the bottom of your screen, there's a section for Q&A. Is there. If you're unable to get to your question during this time, we will just email you directly right after to answer your question, depending on how much time we have for the Q&A later on. Also, if you want to just send us a message directly, you could send it to admissions@scuhs.edu, and we will get back to you right away with any questions you have. Also, after this presentation, the recording will be posted at youtube.com/SCUHS. So you feel free to share that with others or go and see that there, or maybe if you have to leave early, you can always do that as well. Also, you'll be able to find more information about the massage therapy program at scuhs.edu/massage. And without any further ado, my name is Luke Phillips. I'm Assistant Vice President for the School of Professional Studies here at SCU, and I want to welcome Dr. Sunny. Dr. Sunny is an alumni from here at SCU, and he's also the chair of the massage therapy program. And we're really thankful and glad to have him here today, and he's going to take it from here.
Well, thank you for having me, Luke, and thank you guys for being here and coming to this webinar. So I'm here today to talk to you guys about our program here at SCU, our massage therapy certificate program. And today we're going to be going over some of the information and details about our program, as well as preparing students to be able to work in the professional field. And then we have two guests here that will be doing a little demonstration of chair massage, and I'll walk you through that too. So thank you very much for having me here, Luke.
Yeah, good to have you. Thank you for joining us.
So we'll start off with, I've prepared some slides for you, and mission here with our massage therapy program. And let me click this here. So our mission here is to prepare professional, skilled, client, patient-centered massage and bodywork therapists. Again, our goal is to make sure that our students, our graduates, have mastered their skill. And so with that, in our curriculum and in our program, we have lots of courses where there's hands-ons, opportunities for hands-on. And our goal, again, because this is a initial program for students that want to become massage therapists, our goal is to make sure that our students are able to perform a 50-minute full body massage session. And we also go through different modalities, different techniques. I like to say, putting as many tools into the toolbox so that when you encounter any type of situation or patient, you're able to utilize the appropriate tool and make that appropriate clinical decision. So part of that training is making sure that you have a strong science background. And so we have courses that will help prepare students to be able to not only perform massage as well as for therapy, but also to understand what they're doing, why they're doing it, when is it not safe to do it, and things where they may need to refer out to another healthcare professional. So our goal is to prepare you to not only be able to work on your own as an independent practitioner, but also for you to be part of a integrative healthcare team. And at SCU, this is what our goal is to prepare our graduates to become more skilled and prepared to be able to work in an integrative healthcare setting. So SCU is the best place because we have lots of other programs, and our students do get to work with other students in other programs. And so that's one of our major goals here. So the next slide here is going to show you some of the courses that are part of our core curriculum. And so you see at the very top, massage therapy principles and practice. And so again, we're teaching theory, we're teaching about the history of some of these techniques that the students are learning. There are 2 courses that are related to massage therapy principles and practice. The first one is related to Swedish massage, which is the basic 50-minute full body massage that our students learn. The second course is dedicated mainly to deep tissue, as well as other techniques that are focus techniques, such as deep tissue, such as myofascial release, such as trigger point. Again, students are not certified in those specific areas. However, they get a taste of it, so they can add more, as I said before, more tools to their toolbox. The second course, professional students are prepared to be professional healthcare providers in the workplace. And so discussions of ethics and theories of ethics, as well as in their field and in the field of massage therapy. The third course is wellness and health. So one of the things, our overall mission at SCU is for integrative health. And so part of teaching different healthcare modalities, as well as taking care of yourself, right? So it's important to take care of others, learning how to take care of others, but you've got to take care of yourself first. And so understanding your own health, understanding your own well-being, so that there's longevity in what you do. The fourth course here, anatomy and physiology. Again, this is where we have this strong science-based curriculum. Our students go through anatomy, they go through physiology. And in the next slide, I'll share that, one of the great resources that we, and we'll talk more about that. Pathology, again, this is a course to help you prepare. What are the red flags? What are the red flags that are perhaps contraindications to massage? When is it safe to perform massage? When it is not safe? Pathology teaches you these things, and it helps you prepare to be able to make clinical decisions in the real world and in practice. So pathology is very important, and it's part of one of the requirements for you to be able to apply and take the national certification exam, which we'll talk about in the next slide. And last but not least, business and practice. Again, massage therapy is not only a healthcare field, but you need to be prepared in regards into being in your own business or being in your own practice. And again, my hope is that all our graduates are able to start their own business. So we need to prepare you in that way and provide you with the skills and knowledge for business. I'll go on to the next slide. And so these are some of the things that are very special to SCU and our SCU program, massage therapy program here. And again, one of the things that we offer as part of our curriculum is this clinical clerkship. So we do have a university health center where most of our to get clinical skills and work on patients that are from the surrounding communities and come in and receive services. So in our clinical clerkship program, the students are actually working on real live people, patients, and they're going through the whole assessment, patient intake process, as well as being able to take notes, do SOAP charting, what we call SOAP notes or charting notes, and being able to intake a patient and work on them, and then complete the process too. So it's also about customer service. So that's a business skill that we're trying to teach in the clinical clerkship as well. Another highlight of our program is the MBLEX. The MBLEX is actually an exam that in California, you do need to pass before you apply for state certification. So we want you to be prepared and to be able to pass this exam, and so that you can work and get certified. So we do have a course where we call it the MBLEX Preparation and Integration course. And we just received words from the CAMTC, which is our accreditation agency, that for last year, 2017, we had 8 first-timers who took the MBLEX, and of those 8, we had a passage rate of 75%. The passing rate is 70%, so our average was 75%. So we're very proud of that. And then also, as we were talking about anatomy and physiology before, we have on campus an anatomy lab that has cadavers that's part of it. And as scary as that may sound to some of these people in this room too, it's actually an excellent opportunity for you to learn and to see the body. Again, these people have donated their bodies to study, and it's such a privilege and such an honor that we have this resource here at SCU, being able to look at the muscles and the different layers of the muscles and to look at the internal organs. This is such a great resource for here. And so our massage therapy students get to be part of that and take advantage of that resource here as well. And then we also have, as part of our SCU curriculum, a course called spa modalities. And so one of the big things that we've worked with is we've worked with recruiters from Massage Envy, Burke Williams, and one of the services that they offer or they have available for their clientele is stone massage. And so stone massage is one of those very specific and wonderful techniques that you can add as your skill as a massage therapist, but it's in demand. And so we want to be able to, we're communicating with the outside world, with the corporate world, with the massage therapy field, and we're trying to listen to what they want to see. And so that's why we've added this stone massage in order to be able to prepare you to be successful. And last but not least, the great thing about SCU is that we have all of these different programs here on one campus. We have the chiropractic program, we have the acupuncture, Ayurveda, yoga program, as well as the PA program here and basic sciences. So very much so, the students have this great relationship working in this collaborative type of environment where they can study alongside these other students in other programs, as well as, kind of network, right? Because again, when you graduate, you want to be able to know who or where or what opportunities you may have to work. And so being able to network with other practitioners and other programs, this is going to be a valuable resource as well. So this slide here is showing you the, as a certified massage therapist in California, in order to become a certified massage therapist in California, you have to apply to the California Massage Therapy Council. And part of being able to apply to the California Massage Therapy Council, or what we call CAMTC, you must have graduated from a CAMTC approved school. And we are. SCU is a CAMTC approved school. And so all our graduates are eligible to apply for state certification and become a certified massage therapist. And so that would allow you to put that CMT at the end of your name once you've received certification from CAMTC. The other organization, as I mentioned before, the National Certification Board for Therapeutic Massage and Bodywork, the NCBTMB. Their websites are listed here on this PowerPoint slide. The NCBTMB is what we call the National Certification Exam. This is if you're planning to not work in California, perhaps you want to go to a different state, or you're trying to find out whether the training you receive here is eligible for other states. If you take this National Certification Exam, most likely, again, those states will allow you to work in their state because this is a national certification. But of course, they have their exams that you must pass first and an application process as well. So if you are in a different state or you're wondering about working in other states, make sure you check with your state agency or organization that's related to massage therapy. Okay. And then last but not least, we are going to actually talk about some of our details of our current program right here. So all massage therapy programs are based on hours. And so our hours are 625. In California, CAMTC requires that graduates have or applicants have at least 500 hours. So we are definitely well above that. Our program is basically structured into modules, and there are 13 modules that are in a cycle. So basically, you start with the module 1A, goes all the way to module 3B, and then 1A starts again. So it's in a cycle. And because we're in a cycle, we're able to have multiple starts during the year. So it's very convenient and very accessible to you to be able to start in many of these places. You don't have to start at the beginning. You can start in the middle. And again, all courses are actually independent with of one another. There's no prerequisites for each course. And our schedule, we are trying to cater to people that have jobs during the day. So our classes are Monday through Thursday from about 5 p.m. to 9 p.m., so about 4 hours during the week. And then on Saturdays from 9 to 5. And again, the reason why we schedule that is so that you can actually finish this program within 30 weeks or about 7 months. So very much so, this is a program that you can do and it'll go by very, very fast within 7 months. And again, part of our tuition, we include a massage table package that we have discussed and made a deal with our vendors. And we provide the table as part of your tuition. So then we're going to go into...
yeah, we're going to have a demonstration here in a few seconds.
Okay, so you probably have seen that slide on the chair massage. So we want to talk a little bit about chair massage. So chair massage was actually, the modern chair massage was actually credited to David Palmer, who invented and created that first chair massage that you actually see. So here is Tammy, and she's kind of starting her routine, and you can see that she is standing in a very specific way. Okay, one of the things that we teach here at SCU is body mechanics, right? We want you to be safe, and we want you to also have longevity in your career. And a lot of that comes from how you stand. So if you see Tammy standing, she's standing in a specific way so that she is very much kind of like an A-frame, where you're able to support the weight of your own body, but also apply pressure and apply force to the person that you're massaging. So biomechanics is one of the things that we go over again and again and again, and not only with the chair, but also with the table, and working on different areas and different body parts. Another thing that you'll see Tammy doing is that she's using her wrist and her fingers in order to work into Kelsey's neck. She's not choking her, no, hopefully not, but she is working on those muscles that we all tend to have tightness in, and those muscles we call the upper trapezius. And again, as we talked about in anatomy, you're going to be learning about the names of these muscles, where they are, because you need to understand what you're working on and how to work on those muscles, because every muscle has different fibers, have different directions, they're located in different areas, they may be layered on top of each other. So we need to learn, students need to learn about anatomy. And so luckily I teach that course and I love teaching that course. But again, she's working on the upper trapezius muscle, as well as other muscles such as something called levator scapula, middle and lower traps, the rhomboids. You can see that she's working her hands and the heel of her palms into the rhomboids. Again, this is where most people have pain, right? It's up in their neck and upper back, as well as their lower back. So being able to provide relief, being able to work on these muscles and know what you're doing, this is what massage therapy is all about. Right? This is beyond, what people sometimes say massage is just this, right? There is actually more to it. It's way more to it, right? And it takes that time and dedication about these muscles, about anatomy. That's very important. The other thing that you'll see Tammy doing is she's providing different types of techniques. She's using different parts of her hand, parts of her fingers, part of her thumbs to work around. What she's working around right now is the shoulder blade, and then there's a scapula. And she's providing this muscle release technique using her thumbs. Again, we call that acupressure or compressions, and she's just working around Kelsey's scapula here. Kelsey, how are you feeling right now? Let's check in with Kelsey.
Very relaxed.
Okay,
I'm
good.
very happy.
She's very happy. That's a good thing.
Thank you
So,
for inviting me here.
as you can see, Tammy's using different angles, right? She's trying to protect herself, right? She's trying to do her job, but at the same time, she's trying to make sure that she is not overusing any of her joints in her shoulders and her elbows and her wrist.
All right, so why don't we get started with the questions? I know one of the things that often happens as people are looking at different schools, there's a question of what their experience is going to be like. And Dr. Sunny spoke a little bit about the clinical experience. I think one of the things that I find most valuable about the program is that being an established health science university, we have a health center, and that's the place where they actually go. The students will go and have their clinical experience. Could you guys tell us a little more about what the experience is like when you're in specifically the clinic, and what kind of things do the students get to do when they're over there?
I think the biggest thing about the clinic is that it allows students, because students are usually in the classroom and they're working on each other. And so being able to work on different patients and clients that come into the clinic, not only do you have to be in a professional demeanor, you have to practice that, and you have to be able to relate to these patients and to these clients, but also it teaches you about time management. And one of the things that I always tell Tammy and her classmates is that, once you graduate, you have to, you're going to be expected to be able to do multiple massages in a row. So how you are able to manage your time and manage your energy as you're working on patients and clients. This is one of the things that the University Health Center experience, the clinical experience, helps train you in that way. So professionalism as well as time management, I believe, is the most valuable thing about our clinic.
Great, very helpful. And so speaking of the student experience, so Tammy here, thank you for joining us. And Tammy is a current student, so I'd love for you to tell us about the experience as a student.
Well, thank you so much for having me here today. It's been an amazing experience for me. I can't speak for all my classmates, but first of all, the synergy that we have as a group has been amazing. We get along great and we interact well and we work well together, which I don't think always happens. So that's been a real bonus and benefit for me. So one of the things that I really appreciate is when we do work, like even now during our breaks, we'll work on each other during our breaks because, hey, I need something worked on. Can you work on my arm, or can you work on my, so that's really cool. And I appreciate all of the different things that I didn't realize was involved in massage, and in the depth that we go. And I obviously, you're going to have to learn the muscles and you're going to learn about, the organs and all of that stuff, but to the depth that we actually dive into it, I was surprised. So that's been really, really good.
That's great. Good to hear about the really good experience there. I will add, for those who are watching the recording or live with us on the webinar, another thing about this program and all of our programs at SCU is that no matter which program you're in, you're able to take advantage of all the resources the university has to offer. So the Learning Resource Center with all those things, study spaces, and that sort of thing, the Academic Support Office, so if they're having trouble with anatomy or something that's hard for being able to remember all the different things, need support in any kind of way, they're there to help support through tutors and through many other kind of support options that they have there. And the 25 clubs and organizations that the students are able to be a part of would be one more of the kind of student experience pieces that they're able to take part in. So another question I had is around the licensure. I know you talked a little bit about that. So with the CAMTC approval, can you tell us more about where will they be able to be licensed and what kind of job opportunities are there for the students who complete?
So currently, again, in California, in order to be able to work in the different cities all throughout California, you need to have this CAMTC certification. So being able to have that CMT abbreviation at your name, or certification behind your name. And that allows anybody that has that to be able to work in any city in California. This was not the case before 2009, actually, where you had to go to individual cities in order to apply for a permit to work as a massage therapist. There was not a state certification. So with this, it was called the California Massage Therapy Act that went into law, and that allowed the creation of CAMTC. And so when you're able to obtain this certification, you actually have an ability to work all throughout the state. And then so places that you can work on or work at are, it just depends on what is going to be your direction and your goal. Again, we have students come into one class and we teach them all the same recipe, but how they come out and what type of massage they want to do or what kind of massage therapist they want to be. They can go into sports, they can go into more clinical work, medical massage, they can go into spa, they can go on to work on cruise ships, actually, right? So right now, if you look at the industry, if there's a place that's a hotel and resort, most likely you'll see resort and spa, So massage is very much everywhere, even with the growth of Massage Envy, the franchise that has populated all of kind of Southern California. These are also other opportunities that you can choose in order to work as a massage therapist. And of course, because we have chiropractors and acupuncturists here on our campus and graduates of our school, we get calls, we get emails all the time looking for massage therapists to work with them. So it's a natural fit. Massage therapy is very versatile as a career option, and you can apply it anywhere at any different level.
Oh, that's awesome.
Yeah.
Maybe since I have two who are one who's future practitioner and one who already has, maybe give us some examples of like what have you done in your past over your career, and maybe Tammy, if you'd be open to letting us know, like what is there a certain pathway you're looking to go into once you finish the program?
Sure.
You go first? You go first.
Well, when I first came into the program, I'm new to California. So I really I haven't totally figured out exactly where I want to be yet, but I believe I want to go in a clinical environment and work as a healthcare practitioner and work with people to help heal people from the inside. Like that's all part of who I am. And that's what brought me to the school, is the way that everything works together. It just felt like a good fit.
Mm-hmm.
And one of the things that I really appreciated about learning all of the different pieces, even though we're not certified to teach every piece, like Dr. Sunny was saying, we get a taste of it. So if it's something we really want to get good at, we can go get certified in that particular modality and at least know whether or not we're going to like it or not. So that was like yesterday we were doing the lymphatic drainage massage, and it was very interesting. It was totally different than what I expected it to be. And there's so many different needs for that. So that may be something, now that I am more familiar with it, that I might actually go get certified in.
Yeah, it seems like a lot of students actually end up doing coupling their massage training with other things as well. And so it sounds like that may be what you're kind of thinking about doing. And then Dr. Sunny, I know that you've been you graduated as a chiropractor and then also incorporated it into that practice and other things. You want to tell us about that?
Yeah, so I graduated from here in 2003. It's a long time ago, but I graduated, and my background, my family background, we're from Thailand, and I had an opportunity to do an internship with the Ministry of Public Health in Thailand, and that is where I got to learn Thai traditional medicine. And part of Thai traditional medicine was herbology, of course, the study of herbs and natural foods, as well as Thai traditional massage. And so when I had that opportunity, it was such a wonderful opportunity to have. I brought that back to the United States, and I opened my practice in Alhambra, and I had my practice for about 8 years, where I incorporated chiropractic with the Thai traditional massage. And so for me, it's just like, I cannot, for me as a professional chiropractor, there's no way that I can adjust somebody without working on their muscles, because there's that symbiotic relationship between muscle and bone and joint. And so to be able to pass that experience on with the students. So when I'm in class, I share my clinical experience with them and share with them how important what they do as massage therapists, how vital they are as part of the the healthcare team as well as the healing process. So.
That's wonderful.
Yeah.
That's really good. We do have a little more time, so maybe I thought maybe we could dive a little deeper into one of the things you talked about earlier, which the students get to learn a number of modalities. The Swedish and stone and deep tissue. Could you tell us a little more, like what do those mean, and what do you learn? What's the difference in a Swedish and a stone massage and that kind of thing?
Tell me, what do you understand about Swedish?
Well, the Swedish is more of a light touch, and it helps to relax and release the body in a different way than deep tissue. Deep tissue is more of a focused, and it's going to hone in on more areas that have places that really need to be released. So if you've got a knot or like if your muscles are really tight and you need to relax those, then you're going to work more of a deep tissue versus a Swedish, because Swedish is more of a it's a softer massage than the deep tissue.
Yeah, and the intention for these techniques are different as well. With the Swedish, again, that's a full body. That's what you would find at a day spa, like Burke Williams, that you would find at Massage Envy, that you find at a resort and spa. It's a full body, 50-minute or an hour-long massage. And the intention of that type of massage is really very much to stimulate circulation and to reduce stress and to relax. Because again, when you go get a massage, your shoulders are probably up here already. So this is time, this is a universal sign for I need a massage, right? When your shoulders are up here and you have no neck. So I'm saying that, I'm not sure if that's true or not. But anyways, that's what a Swedish is for managing your stress. And we understand that in our day-to-day world, we are inundated by stress, and so Swedish very much is geared towards addressing that and circulation. Maybe issues of people that have swelling or edema, or what we call lymphedema. Swedish massage would be appropriate for that. But then we have the people that may be athletes and sports fanatics and weekend warriors, right? And they get these bruises and bumps in their bodies. They knock their knee into the wall that they're climbing, and they get injuries, right? And so with injuries, you have buildup of scar tissue, you have adhesions, you have past childhood traumas like spraining your ankle or falling off your bike. Well, deep tissue and these other is like a focused modality, right? You want to focus on those kind of repairing that area that didn't heal properly. Most people that have had injuries before, they say, my shoulder doesn't move the way it used to move before the injury. And a lot of that is not because of fractures or broken bones, but it's actually because of scar tissue and muscles. And so with deep tissue, as Tammy was talking about, it's focused, it's geared into that, it's focused on that one area. And so we want our students to be able to, and graduates to be able to be prepared to be able to do those modalities too. Yeah.
What's really cool with that too is as you get into this, you actually can feel it, and you hone right in on it. It's like, okay, I got to work this and release this, and then you can feel it release, and then you move on to the next area that's that needs more focused attention.
Yeah.
I love how you give the example of the person who comes in and says, there's something I used to be able to do and I can't do anymore. And then they come in for massage and you're able to really help people. It must be a really fulfilling kind of thing to do that. Would you say that's been the case over your career and through your time doing it so far?
I found it really fulfilling to working with even just my students, the fellow students, is that helping them work through certain issues. It's really fun to see that transition.
I love also I think the massage program encompasses a lot of what SCU's mission is all about. We talk about our mission is to prepare caring and competent and integrative practitioners. And so we talked a little bit already about the integrative piece, the idea that as different professionals bring the best of what they have, it results in great value to the patient, often at lower costs to them as well. The competent piece we've talked about are the scholarship and the academic level, the accreditation and licensure. But now we're kind of talking about the caring piece and how it really does help change people's lives, and that's kind of what it's really all about. So really good to hear that from you guys.
Well, I think also, you develop that while you're in the program. As Tammy said, her group, they're very much, they get along and they care for one another. And so when they're practicing massage on each other, that care comes through. And so it becomes part of their pattern, is that whenever I'm going to be massaging, then I have that focus, that intention. And we talk a lot about that in regards to your energy, your intention, your focus, that when you're working with people, to make sure that you clear everything out, because whatever is going on inside of you is going to translate through your touch. And we all understand the power of touch and what touch can do, and how much effect it can have on a person. So being able to understand that internal being is what comes out through your hands. That's what we go over, and we talk a lot about that in our program. Yeah.
Yeah, that is one of the first things that you do, is you basically release everything out of your own energy, and you get in sync with the person that you're working with. So
Yeah.
That's really interesting. Yeah, good. Thank you for sharing that. I'd never thought about it that way. That's really interesting to hear. We're doing really well on time, and we haven't had a whole lot of questions from the audience yet. So maybe, is there any other pieces anything about the program that you would want to highlight further before? And then I'll ask a few more just kind of financial aid and other questions.
So one of the things too that is part of our program is, and part of other programs too, is that we do a lot of community work. We do have a lot of people that contact us to say, could you please come and maybe provide some massages for our event? And a lot of those are health fairs. But we've also done events where related to cancer survivorship. So we've done the Relay for Life with the American Cancer Society. We've had events where we've worked with wives of military servicemen. And we've been called and asked to do those types of events, as well as in the past we've done events where we did provided massage or spa day for people on Skid Row, and that was just amazing. It's amazing experiences that's beyond the classroom, right? Beyond the classroom, and being able to get the students out there into the community. And the biggest thing is just all the positive feedback. That's the biggest thing, is when you guys go out there, they're just so overjoyed and just so grateful that you're there. And I think that also helps to boost your confidence as a practitioner. The more experience that you get, the more people that you work on, that's where your, I guess, your second education is, right? We teach you inside the classroom. We provide the books and the lecture notes and the PowerPoints. But really, it's the practice, it's the real life experience, it's the dealing with the people out in the community that you really get your second education, and makes you a stronger practitioner, ready to be able to, they always say, like, if, for instance, if you're gonna learn how to drive a car, and if you know how to drive a stick shift, then you're able to drive any type of car, because that's the hardest one to master and the hardest one to learn how to drive. So if you have these kind of challenges presented to you and you're able to overcome them, then all of a sudden, then you're prepared for anything. So that's why we try to integrate these kind of community events into our program, as well as guest lectures. So we try to have guest lectures in our class from the other parts of our SCU community. And we integrate, a lot of these technologies. So we do watch, a lot of these kind of helpful videos on YouTube to kind of, take students beyond the classroom, beyond the books, so that their education is enriched with all these kind of resources that are available online. What you're saying, the LRC, I've worked with our wonderful librarians at our school, and they are always trying to find the latest video on massage therapy, on a certain technique that we could share in the classroom, or helping us with research regarding massage therapy. Again, what are some of the research out there that validates what we do as a profession, and in regards to clinical care? What are some of that research that we can read and research and present, so that we can move forward and to grow as a profession? So we do that, a lot of that in our classes and utilizing the resources here at SCU. And other than that, the student life too. I mean, there's lots of these different events that we have on campus, and a lot of these, in the last time we were at Chinese New Year, celebrating that, and there was a chili cook-off that we went to. So it's very much, a place where you work and you learn, but also to live as well,
Experience.
and to experience it. And I think that we do such a great job here, and to provide that experience for you guys.
One of the things that you forgot to mention was having the high school come in.
Oh yeah.
We had one of the high school programs come in and
That's
massage them for
Oh,
an
really?
hour, a couple
Yeah.
Saturdays.
It was a local high school where they had a running team, and one of their faculty had reached out to us and said, we have some injuries with some of these high school track students. Could we possibly organize something where you work on these students? And we've actually done that too at Cal State Fullerton. When we went to Cal State Fullerton in the previous class, we went to Cal State Fullerton and we worked on runners there too. So we very much enjoy kind of being integrated into the community and having community learn more about us and what we do, but also giving back to our community, right? I think that's a social responsibility that we have, to volunteering and to being part of that.
Personally, I'm a real big fanatic for that. I always want to be part of the community and give back to the community.
And you enjoy it, and I'm sure they enjoy it a lot as well. The high school students must have loved coming over.
Yeah, that was interesting because that was a lot of them, their first experience with massage.
That's right.
That's so good.
Yeah, it's kind of like, and that's where, we want to prepare you to be able to talk about massage, and that's part of professionalism. Being able to talk about what you do, being able to speak the language of massage therapy amongst not only people that are your patients or clients, but also other healthcare providers too, being able to kind of have your own place in the healthcare team, and your input as well. And so again, Luke, as you were saying, with this whole, goal that we have at SCU with integrative medicine and integrative health, that's what we're trying to prepare you all for too.
Yeah, that's so good. Was there anything else?
Most of the events that we do are focused. I mean, you're usually with the chair, but they are focused. We'll usually ask the client what area do you want worked on, and we'll work on specifically the areas that they are having issues with.
That's so good. Well, so we've actually looped back around to a lot of the earlier presentation, which is really good. We've talked about the modalities a little bit. We talked about professionalism, talked about the student experience. Now, one piece that I do want to loop back around to also is the MBLEX preparation. So as those who are watching, for them to be aware, that's the test that is needed to take. And I think a lot of programs, you finish the program, and then the hope is that you're able to then go on your own and take the MBLEX. And so there are actually 2 MBLEX preparation courses built into the curriculum.
Yes.
So throughout it, they will get those 2 courses and then be prepared for that. Is there anything you'd say about those courses?
I think half the battle of taking any exam is being calm and focused about it and getting over the jitteriness of it. So as part of these MBLEX courses, we go over the application process. We go over what it might be like in the testing environment itself. Again, the MBLEX is a computerized test, but you have to go through all these security checkpoints in order to even get into the room to take your test, and that could be nerve-wracking. So kind of going through that, explaining that, as well as the format of the actual MBLEX, understanding the different parts of the MBLEX, understanding what you need in order to pass. So that's all part of the pre-work that we do in this preparation. But then we go into the sample questions, right? Being able to review everything that you've learned in the courses that you've taken, and then reviewing that information in a way that prepares you to take this exam. So we do a lot of sample questioning. There's a lot of resources such as apps that are available. And so it's so that when you get to that point of having to take the MBLEX, you're ready. You're ready for it. Not, you've graduated and you have to go through this whole preparation process on your own and have to deal with that before you even take the MBLEX. So the instructors, both the other instructor and myself, we've both taken the MBLEX, so we understand what it's like. And so we pass that experience on to the students.
And that's a good segue actually into one of the last things I want to talk about is the price. And so just in case there's any question, the price does include everything we've talked about so far. So it includes the MBLEX, both classes. It's 125 hours of clinical experience. Is that right? Around that?
75 of the actual hands-on clinic, and then 50 is learning about the different assessment procedures.
Okay.
So getting you ready for a clinic. So things like SOAP note charting, being able to assess posture, assess gait, what we call when someone walks and you watch how they're walking and what's happening. So that is 50 hours of that, and then 75 hours of the actual hands-on.
Okay. And so it includes that, and then also they actually get a portable chair that comes included.
Table. They get a whole table.
A whole table. All included in the tuition.
Not half a table,
Yeah.
the whole table.
So we also got a bolster. We also got a
Right, it's the whole
Okay.
package,
So
right?
it comes with
So they get a
couple
carrying
things.
case, they get a bolster, the whole headrest and stuff
Mhm.
like that. So that's part of the tuition also.
So really, it's everything you need to kind of get started
Yes.
as in whatever route you end up going. You're gonna even have the chair, your own chair, and the MBLEX prep classes and the clinical experience. So you're not going out as if there's a lot of steps you need to do, like getting clinical
Yeah.
experience, buying these things, or preparing for the test somewhere else. You kind of get it all in the one program.
Yeah.
So
But there are fees that are involved with the next steps, like to actually get the certification. But other than that, everything is included.
okay. Good, very helpful. And I think we may have, I have to double check this, we have a chart, I think that may have some of the additional fees, maybe not those afterwards, but I think there may be some others in the class. So,
Yeah.
but those are always up on our website if anyone wants to look up those. Another thing I'd say about the tuition cost is there are a number of financial aid opportunities between the right now the private loans and payment plans, and then we're as of the recording of this today here in summer of 2018 at the latter portion of the application process for Department of Education Title IV funding. So we expect that to be completed pretty soon, and then students will even be able to get funding that way as well. Okay, I think those are all the questions I had. Anything else you guys want to add before we finish up?
Do you have any questions for me?
I know you love the program.
I do love the program. I really do. It's really
I love the
been
program,
an enlightening experience. I personally, I didn't realize how deep we were going to go, and that's been really cool in a lot of ways. And there's a lot of things that, like one of the things we had to do was research a specific modality and do a presentation on it. And when we were first assigned it, we're like, what do we got to do that for? But by the end, it was really cool because each person had to focus on a specific one and talk about it. And we learned so many different things that, oh, maybe I'd be interested in that. Well, I don't want to do that. So you really got a lot more in-depth information from your fellow colleagues.
Wonderful.
And a little bit about, my previous experience. I've been a program chair for other massage schools as well. And the one thing that really brought me to SCU was, first, I graduated from here, so SCU is my alma mater, so I love working here. But the other thing too is that the schools or the programs I used to work at didn't offer a health center to work in. They didn't have an anatomy lab that we can actually see the cadavers and the real life structures that you're studying in class. So just having those two resources, I think really very much enhances your education and your knowledge and your understanding of the human body and what you're doing as a massage therapist. Being able to have that clinical experience and then actually being able to study the body itself. I know that there was this kind of traveling show, the Body World or Body Works, where they had cadavers that were plasticated. They had bodies that were plasticated, and you can go to see. And if you've ever been to that museum or that show, what you learn about your own body and our bodies is such an amazing and blessed thing that we have. And so to be able to study it while you're in massage therapy, it links everything together. It makes things make more sense. You have that kind of aha moment. And then applying all of what you've learned to working on patients and working on clients, you're going to be a very strong massage therapist. And again, as I said before, that a lot of people do contact us because they know we prepare our students in a certain way, and that they have this very strong science background and they're able to make clinical decisions and being able to catch, the red flags where it may not be safe for massage. So we have a lot of people that inquire about our graduates in our program. We just in the past have not had enough people to be able to send out to the working world because they find jobs and they stay where they are and they love it. And so part of it is sometimes I have to say, sadly, everybody has a job already. So perhaps the next batch of students, or maybe you, will come and be part of our program and be a graduate at SCU.
Even within our class, most of my classmates already have something lined up.
Wow. Oh, it's good to hear.
Yeah.
Yeah. Well, this has been really informative. So I really want to thank you, Tammy and Dr. Sunny.
Thank you very much.
And Kelsey for enduring the demonstration. A couple reminders before we finish. If those of you who are listening, whether you are listening on the webinar or on the recording later on, we would love to engage with you in our Office of Admissions with any questions you have about what we talked about in the presentation today or admissions related questions. So if you want to do that, you could always email us at admissions@scuhs.edu. If you're watching the webinar, feel free to come and view this again or share with others at youtube.com/SCUHS. More information about the program, if there's something you feel like you missed, most of the information we just talked about is up on our website at scuhs.edu/massage. Also, if you are listening and you're really interested in the program, the first step is to apply. And so if you feel like you're ready, the application takes anyone around less than 15 minutes. So we would really encourage you just to go ahead and go online and do the application. It's at scuhs.edu/apply. And if you use the code waiver in all caps, that will waive the application fee for you as well. So if you want to go and do that today, the application fee waiver will be active for you. Also, if you wanted to come and experience it and hear from Dr. Sunny and others here in person on campus, we offer tours throughout the week. And we also have open house and campus preview day and other upcoming webinar events. And all of those are at scuhs.edu/events. So I want to thank everyone once again, and we look forward to having you join us for a future event or webinar. And thank you for joining us.